Hi, everybody. This is part 2 of treatment, and it ends up being starting with day 4 at the pace we've been going lately, but that's okay. So today it's not the most visual subject. I always like to show pictures and videos and stuff, but cognitive therapy is what I'm teaching you right now. Write this down. Cognitive therapy, I don't, there's not a lot on YouTube about it because you can't really watch real therapy. It takes too long. It's not as interesting as it seems. I could find you fake videos or actors doing it, and it's pretty interesting, but we're going to do without that this time, okay? So write this down. So I want you to know what the word cognitive means. Cognitive means thinking, means thoughts, beliefs, attitudes. So from a cognitive perspective, the reason you're depressed is because of the way you think, your maladaptive thoughts. Okay, that's what causes depression. Like for example, if your expectations are too high and your expectations aren't met, that's why you're depressed. Let's say you're depressed because that boy or that girl rejected you. Okay, that's your thinking. Let's say you're depressed because you don't have a car. Okay, or you're depressed because, or how about this? You're depressed because you think nobody likes you, but even though that's not true. So a cognitive therapist is about attacking those maladaptive, irrational, dysfunctional thoughts. Maladaptive means that it's personally distressing to you. Look, mala, bad, okay, or mal. In English, we have a lot of words that begin with M-A-L, malnourished, okay? It means bad nourishment. Mal means bad, okay? So cognitive therapy is about changing your maladaptive thoughts and replacing them with constructive thoughts that do not give you distress. This can be a confrontational therapy, and it does focus on the present. So while humanistic therapy is all like, I'm just here to guide you, not cognitive therapy. Cognitive therapy is a little bit more confrontational, okay? And they do focus on the present rather than the past. When you go to a cognitive therapist, they will ask you about the past, but they're not going to focus on that. They're going to focus on what are you doing now to make your problem worse, okay? So don't write this down, but this is me. This is what I came up with as what is the cognitive perspective of mental disorders. We are depressed because we are irrational. Our expectations are too high and misplaced. We want everyone to love us and accept us. We want everything to go our way. We stay angry about stuff that happened a long time ago. We must change the way we think to be happy and successful. Okay, so one more example. Let's say you go up to a friend. Hey man, what's wrong? Oh man, I'm depressed. Oh, what's wrong? Well, I broke up with my girlfriend and it's really hurting me. Oh, when did you break up with your girlfriend? 5 years ago. You see the problem with that? That is a problem with his thoughts, and he needs to change his thoughts. And if you're trying to help this person, you might say, like, oh, well, okay, well, I mean, how much time do you think it's okay to pine over your girlfriend from that long ago? Okay, I mean, it's normal to do it for maybe a month or less, but 5 years, I mean, that's a bit scary and concerning, okay? So that's what a cognitive therapist would do. All right, names aren't that important in this class, but go ahead and write these down. these are two names that I want you to be vaguely familiar with. You've got Aaron Beck, who is the founder of what's called reality therapy. And he said that patients are being unrealistic, and that's why they're depressed. And that to help a patient, you have to get them based in reality. Albert Ellis is my favorite. I've actually read a book by him. And I'm going to have a whole separate note card in a second on what's called rational emotive therapy. Both of these are forms of cognitive therapy. And check out the cartoon. That's pretty good. Change your thoughts. All right. So Aaron Beck, cognitive therapy. And, I'll tell you something I read about Aaron Beck. He's kind of hardcore. He actually took schizophrenics and he told them about how irrational it is to have hallucinations. And he actually helped people with schizophrenia using cognitive therapy. Normally with schizophrenia, that's the disease where you have hallucinations, okay? You usually take antipsychotic medication, but he's like, I can help people. So there's a book by him, Cognitive Therapy and the Emotional Disorders. Okay? All right, moving right along. If you want to write this down, fine. I don't want you focusing on names too much in this class, but I do want you to write this down. Albert Ellis's Rational Emotive Therapy. And I've actually read one of his books, and they're really useful. Just type his name in the Amazon and pick one. They're all pretty much the same, okay? Vigorously challenges people's illogical, self-defeating attitudes and assumptions. Look at that, attitudes and assumptions. Those are just synonyms for the word thinking and cognitive. Cognitive means thinking. And this is a confrontational therapy. Imagine if somebody said, the reason you're depressed is because you're being a spoiled brat and you need to lower your expectations. Right? I mean, that can be kind of insensitive. I mean, if somebody's depressed because of the lockdown and they can't see their friends and they can't go to school, I mean, I think that needs a little empathy. But there are limits, though. There are limits. So if you want to be more humanistic, be a little more empathetic. You want to be a little bit more confrontational, that's more of what cognitive therapy is. That's more rational emotive therapy. And I don't know which one I prefer, honestly. Most counselors and therapists are a little bit of both, depending on the patient. All right, moving right along. So I want to tell you about rational emotive therapy, and I honestly think that this is useful. I don't think that everything I teach you is useful, but I think this is useful. And by the way, I went to a counselor, and he actually had this. He had ABC written on a marker board. He was actually using ABC with one of his other clients. So this stuff is real. This is stuff that you would learn in a master's degree counseling program. It's called the ABC theory of dysfunctional behavior. So you have the you don't need to write this down. You have the activating event, that something happens to you, and then you have the belief that you have about that event. And then C is the consequence, the emotional consequence based on that belief. So here's the scenario. All right. Let's say you fail a midterm examination. And let's say theoretically this is your belief. It's unfortunate that I failed. I did not study hard enough, and I must make sure that I study harder for the final. Okay, that is a healthy belief to have. So as a result, there is no consequence, no depression, no anxiety, no emotional disturbance, because your belief is healthy and rational. But what if your belief is irrational? You fail an exam, And your belief is this: I'm stupid, I'll never be able to pass this course, and I will fail this course. If you believe that, then you will be depressed. You will not be happy. So what is rational emotive therapy? It's to attack the B, okay? Vigorously challenge that belief and replace that belief with something rational. That is rational emotive therapy. Okay, and that's what a counselor or a therapist might do with you. Okay, so let's look at some of Albert Ellis's list of common irrational ideas. Now, keep in mind that if you think any of this stuff is true, then you will probably be depressed. I absolutely must have sincere love and approval almost all the time from all the significant people in my life. That's not true. You don't, like, for example, my daughter got a tattoo and I'm not happy about it. But you know what? Life goes on. From her perspective, she disappointed her dad, and that's just tough luck for dad, and we'll all just get over it. You don't need everyone's approval all the time. Let's look at the second one. I must be thoroughly competent, adequate, and achieving in all respects. Or I must at least have real competence or talent at something important. Otherwise, I am worthless. Let me tell you something a little radical. You don't have to be good at anything. You certainly don't have to be good at everything. You don't even have to be good at anything. You could just be okay at everything. Life goes on. It's okay. Now, here's the last one, something that I've struggled with. People who harm me or do a bad thing are uniformly bad or wicked individuals. And I should severely blame, damn, and punish them for their sins and misdeeds. You know, like somebody cuts you off in traffic and you just want to honk at them, flip them off and stuff, punish them in some way. Just because somebody does something bad to you or hurts your feelings doesn't mean that you should try to get revenge or something. That is not good for you. You might have heard of people, when you hold a grudge, you're letting people live in your head rent free. That's what that's about. Okay. Here's a couple more. When things do not go the way I would like them to go, life is awful, terrible, horrible, or catastrophic. Okay, like you crash the car. Oh my God. I mean, I get it. It's bad, but you got to move on. Or you have a breakup. And maybe after a month, you need to move on, okay? You cannot let these setbacks get to you for longer than a certain period of time. And finally, unhappiness is caused by external events over which I have almost no control. I also have little ability to control my feelings or rid myself of feelings of depression and hostility. Well, that's a little true, but then again, it's a little false too. You need to believe that you have some control over your mood. Okay, you need to at least believe that you have some control. But then again, chemicals are chemicals, okay? All right, so moving right along. So you take the ABC theory of rational emotive therapy, and then as a counselor, you teach the patient to dispute those beliefs and substitute logical and rational beliefs. So replace the B. And then evaluate the effects of disputing their irrational beliefs. So how's that working for you? Now that you don't believe this, and now that you do believe this, how do you feel now? And that's good therapy. That is some good therapy right there. Okay, you don't need to have all this memorized, but I do think that this is useful. Okay, you can play with it with your friends or yourself. I've done this to myself a few times. One time I thought every teacher in the building didn't like me. And so what I did was I mentally went down the hall and I said, does he like me? Does he like me? Does she like me? And then I came to the realization that people don't really even have that much of an opinion on me one way or another, or they do like me. And if one person didn't like me, then oh well, then life moves on. Okay? So before CBT, cognitive behavioral therapy, you have this visual. And then after CBT, you have this visual. Hit pause if you want to look at it. Hit the space bar. All right, moving right along. All right, so cognitive behavioral therapy is effective for which disorders? Now, I highlighted a word that I need you to know because I have seen this on the test in various ways. Empirically. Empirically is a fancy word for meaning that it is scientifically backed up in the laboratory. That's what empirical means. Write that down if you need to. Empirical means that it's science, it's scientific, and it's backed up by science. That's it, backed up by science. So CBT is really good for depression, anxiety, OCD, and other anxiety disorders. It's not the greatest for like schizophrenia and stuff, even though Aaron Beck said he had some success with it. Okay? All right, moving right along. So this is a summary. What causes mental disorders from the cognitive perspective? Irrational thoughts and beliefs. Maladaptive thoughts and beliefs. How do you treat disorders? Change the thoughts and beliefs through rational emotive therapy. And even Aaron Beck came up with one that's called reality therapy. That's what it was called, reality therapy. Okay. All right, so let's do some multiple choice. All right. In treating a patient for depression, Dr. Pratt focuses on changing the ways in which the patient interprets events. Which type of therapy is Dr. Pratt using? All right, the answer is cognitive. Interprets, thinking. Cognitive means thinking. Okay. Psychodynamic therapy, that would be getting into your unconscious. Biomedical therapy, that would be medicine. Okay. Moving right along. Rochelle is anxious because she believes that nearly everyone must approve of everything she does. Which of the following is a cognitive therapist most likely to do to help Rochelle overcome her anxiety? All right. So avoid anything that's like learning therapy, like behavioral therapy. Avoid any psychoanalysis. Avoid any humanistic therapy. And look for something that's changing the way that she thinks. Okay? The answer is right. Change in the way she interprets or thinks or believes. A and B, that would be more like behavioral therapy, positive and negative reinforcement, stuff like that. Rewards and punishments, that's behavioral. That's not cognitive. And E, that would be more like psychoanalysis. D, that would be behavioral therapy too. That would be like systematic desensitization. That's behavioral therapy, not cognitive therapy. Okay? All right. Which of the following psychological theories would explain PTSD as being the result of irrational beliefs and ideas? Okay, not the best example in the world, but go with what they give you. The answer is irrational beliefs and ideas. That's cognitive. Okay. The goal of rational emotive therapy is to help clients do what? Okay, so it's a cognitive therapy. The answer is, look at your notes. The answer is thoughts, cognitive, the B of the ABC. Okay. According to rational emotive behavior therapists, the source of much unhappiness is the individual's what? Okay, so avoid anything that's psychoanalytic, avoid anything that's humanistic, avoid anything that's behavioral. The answer is look for something cognitive, look for something thinking. The answer is E, beliefs, thoughts. Remember the ABC? They gave you a B word right there. Okay, moving right along. The role of the therapist in cognitive therapy is to do what? Okay, the answer is irrational beliefs. Identify the irrational beliefs and replace the B. Okay, B, that's humanistic. C, that's psychoanalytic. E, that's biomedical. D, that's behavioral. It's a good question. Okay. One difference between psychoanalytic and cognitive models of treatment is that cognitive therapists, all right, the answer is C. Cognitive therapists focus on the present, psychoanalysts focus on childhood and the unconscious mind. Okay? All right, moving right along. Who would suggest that cognitive distortions or errors in logic that are blown out of proportion could lead to psychological disorders? All right, the answer is Aaron Beck. It could have been Albert Ellis as well. Okay. All right, the cognitive theory of depression states that depression results from what? Okay, so what causes depression according to the cognitive perspective? The answer is interpretations, maladaptive interpretations. Interpreting is thinking. Okay. B, that would be biomedical. Okay. E, that would be psychodynamic. Okay, or psychoanalytic. All right, I have not seen this on the test, and I might give you one question on your EOC, but I will say this. Most therapists are what you call eclectic, meaning they use tools from all different perspectives. They could be a little bit of cognitive, a little bit of behavioral, and a little bit of humanistic. You're probably not going to dabble in psychoanalytic. They're not just going to dabble in dream analysis. And they're certainly not going to dabble in biomedical therapy. So it's these three perspectives. Most therapists describe themselves as eclectic, meaning they just take a little bit of each. Okay? I haven't seen that on the test, so let's not worry about it. Group therapy. Group therapy is important. I've seen 2 questions on it. Write this down, at least write down the red. All right, hit pause if you don't want to hear me talk, but one benefit of group therapy is that it's cheap, meaning you have one professional and maybe 10 patients in the room at the same time. And it's cheap because you only have one professional, but you can split the cost among people. It also allows people to talk about their problems, the same problem you have, and it gives you insight into hearing other people talk about the same disorder. And also, it makes you not feel lonely, because when you're sad or you're depressed or you're addicted, you know, this is good for addictions too, like 12-step programs, AA and stuff, or support groups. You don't feel alone. And the loneliness can be a real problem when it comes to depression or addictions or stuff like that. People don't want to feel like they're special. You don't want to feel like your disorder makes you special. Okay, that is not good for you. Okay? All right, let's try a few. All right. An advantage of group therapy over individual therapy is that group therapy does what? The answer is Right. You don't want to feel special when it comes to your disorder, and group therapy is good for that. Okay? All right. All of the following are potential benefits of group therapy, except, okay, so you're going to have 3 benefits and 1 thing that is not a benefit. Okay? The answer is B. The answer is B. Okay? It does require an expert. You have to have an expert. Otherwise, it's not therapy. Okay, so the answer is B. Okay, that B is not a true statement. A is a true statement, so that's not the answer. Okay? All right, moving right along. The answer was B. Self-help. I've seen this once on the exam. Self-help is when you go get a book and you read it to try to help yourself cure your problem. I'll be honest with you, it's not the easiest thing because some of these are so cheesy, but that doesn't mean that you can't get benefit from it. I mean, I read a book by Ellis, and I think it really helped me. I've read a book on narcissism. But a lot of these are really just inspirational, and there's nothing wrong with that. Is it real therapy? I don't know. I don't care. But if it's good for you, then it's good. Honestly, when I look at these books, I tend to read the first third, and then it just starts to repeat itself. So I only read like a third of these books. Now, I did not teach you this, but self-help and support groups are an outgrowth of which therapeutic perspective? So self-help is kind of like touchy-feely, and it goes along with free will. You can be all that you can be. So it does come out of the humanistic perspective. Okay? All right, write this down. This is a new perspective, not new to the field, but new to us. What is biomedical treatment? Biomedical treatment, biology, medical, it involves the body, it involves your hormones, your neurotransmitters, it involves your brain. So this would include medicines, prescriptions, surgery, which is rare, but that would be part of it, and ECT. That doesn't mean etc. It means electroconvulsive therapy. And I will teach you that, and we will write that down in a second. ECT is electroconvulsive therapy. And you would get biomedical treatment from a psychiatrist. So when you go to a psychiatrist, you expect a prescription. You don't expect to talk to the psychiatrist for an hour. That just doesn't happen very much. Okay? All right. Write this down, unless you just know it, because some of y'all already know this stuff. So if you have a disorder like schizophrenia and you have psychotic symptoms, meaning you're seeing things that aren't there, like you hear voices or you have hallucinations, then you need to take an antipsychotic medication. Okay? You do not need to have memorized the brand names of psychotic medications, antipsychotic medications. If you are depressed, then you might take an antidepressant. Prozac, it's good for you to know. I know I'm contradicting myself, but you do need to know the brand name Prozac, okay? It is that famous and that common. And you need to know what an SSRI is. I generally teach it in a different chapter. I'll explain what that is. But if you're on Zoloft or Prozac, Abilify, I think, Seroquel, I think those are all SSRIs. And one of the S's stands for serotonin. It messes with your serotonin levels. And if you have anxiety, then you need to have an anti-anxiety medication. And these medications work on GABA. GABA chills you out. It's a neurotransmitter. Examples would be Xanax, Valium. Klonopin's really good, but I don't know if that's specifically an anti-anxiety med. But yeah, anti-anxiety is for anxiety disorders. All right, moving right along. Moving right along. Hit pause if you need to. If you want to look at this, hit pause. There's a lot of information. Okay, moving right along. By the way, tardive dyskinesia. Now, earlier I said that tardive dyskinesia is a side effect of antipsychotic medications. So tardive dyskinesia is tremors. So here's the deal. Schizophrenia is a problem with dopamine. And when you have too much dopamine, you have schizophrenia. But if you have too little dopamine, then it affects the movement of your body. So when you're taking a medication that reduces your dopamine levels, you're going to get something that's like, that makes you have tremors. Okay? So so sometimes if you have schizophrenia and you're taking antipsychotic meds and you have tremors, like you just repeating the same bodily movement over and over again, then that's a side effect of antipsychotic medication. On your quizzes, I'll have a GIF and it'll look a little bit better. Okay, so that is a side effect of antipsychotic medications. All right, this is a little bit more than I want you to learn, but this is important. This is on the test. I generally teach this in the nervous system. When you take an SSRI that's like Prozac, what it does, imagine these yellow balls as serotonin. An SSRI makes it look like there's more serotonin between two neurons. Basically, it makes your brain think that there's more serotonin than there actually is. That's what Prozac does. It operates on serotonin. That's all I need you to know right now. Okay, just a joke. Okay, so Prozac and other modern antidepressant medications work to do what? I don't want to spend time on this, but the answer is D, and I misspelled serotonin. Serotonin's not the easiest word to spell, and Google Word doesn't seem to know how to spell it either. Okay, I'll show you a better question later. Okay, write this down. Write this down. Electroconvulsive therapy. We used to call it electroshock therapy, but that is not what it's called anymore. Electroshock therapy is not what it used to be. All right, I'm going to play you a video right now that's less than 2 minutes long.
ECT stands for electroconvulsive therapy, which is a treatment that we've been doing since 1938. It's not new, but we've certainly changed a lot since then. And essentially it involves giving a person general anesthesia. Once they're asleep, we give them another medicine through their IV to relax their muscles. And once their muscles are relaxed, I deliver an electricity current that lasts for 1 to 8 seconds. It results in a seizure that lasts for 20 to 60 seconds. During which time a person, an anesthesiologist oftentimes has to breathe for the person for that brief period of time, after which the person wakes up. That's a very short version of a treatment that takes 3 to 4 hours from beginning to end from when a person gets to the treatment to the end of the treatment and when they can leave the hospital. And is done in a series of treatments. So it's not just one treatment, but rather treatment typically Monday, Wednesday, and Friday, so 3 times a week for 2 to 4 weeks, and then at a decreasing frequency after that as a person gets better. ECT is the most effective acute treatment for depression that we have. Most studies will say that for people, so it's a pre-selected group of people who already have a refractory depression, so they already have kind of a more severe version of depression that has been harder to treat. So for that group of people, 50 to 70% of people will have a full remission of their symptoms. Here at Porter, we have a higher rate of response. People that have, on a variety of different scales, a 50% or greater reduction in their depressive symptoms.
Okay, all right, so it does work. All right, I'm telling you, the studies show that it does work, but the problem is that it's expensive. That's the problem with ECT. It's too expensive, meaning you need a psychiatrist, you need an anesthesiologist to put you down, you need you need techs to monitor the equipment, you need a psych nurse, you need way too many people. But it does work. And there is a side effect, and the side effect is memory loss. But if you're depressed, you probably don't want to remember anyway. So, all right, so that is ECT. This is a form of biomedical therapy. Biomedical, okay? All right, research on ECT has shown that it is most effective for treating which of the following disorders? The answer is major depression. That is the answer. I believe it can work for OCD, but that's what the research shows, that it's depression more than OCD. Okay? All right, moving right along. TMS. TMS is, I have not seen it on the test, but TMS is what it does is it shoots magnetic pulses into your brain, and the studies show that it works. Okay, the studies show that it works. I'll play a little bit of
interesting technology. It's actually based on Faraday's law, which is a law that states that every magnetic field generates an electrical current, and vice versa. Every electrical current generates a magnetic field. In this case, we use very, very powerful magnets in a special configuration that then generate an electrical field at a distance. And the electrical field has a direction to it. And so we can apply these very, very powerful magnets to or near the surface of the head, and at a distance, a few centimeters away, will generate an electrical current. And that electrical current will end up stimulating certain areas of the brain, certain populations of neurons, and that triggers certain pathways in the brain to become active that previously may not have been active. And by activating those brain circuits repeatedly on a daily basis, what we can actually do is sometimes permanently alter brain function for the better. So there's a lot of degenerative conditions, for example, Parkinson's disease, Alzheimer's disease, and other psychiatric conditions such as depression, where the fault lies in a circuit not triggering repeatedly, and this technology forces the brain to trigger that circuit and permanently alters, for the better, brain function.
So that's called TMS, transcranial magnetic stimulation. That is a form of biomedical therapy. Okay? Surgeries are rare. Okay? Back in the 20s, we had some what are called lobotomies. We don't do that anymore. It's when you stick an ice pick up your eye and you damage the frontal lobe to help you with anxiety and depression. That has been replaced with a pill called Thoracine. And that's an old medication from the 50s, but we don't really do lobotomies anymore. Okay? But that's like just an old-fashioned, that's just part of the history. That's what a lobotomy is. Just sticking an ice pick up your eye to damage your frontal lobe. Okay? Okay, so psychotherapist who believes that deviant behavior can be traced either to genetic anomalies or to problems in the physical structure of the brain most likely subscribes to which of the following views of abnormality? Okay, so if it's genetics or chemicals or neurotransmitters, the answer is biomedical. Carmen's psychiatrist has prescribed a selective serotonin reuptake inhibitor, an SSRI, to help Carmen feel better. Carmen has most likely been diagnosed with what disorder? All right, so if it's an SSRI, then that's like Prozac. Then what is this for? This is for, the answer is depression, major depressive disorder. Prozac has been shown to reduce depression primarily by doing what? All right, you may not know this yet because maybe you didn't write it down and I didn't teach it good enough yet, but the answer is D, serotonin. It's all about serotonin. A medication that primarily enhances the activity of GABA in the brain would be likely be used for the treatment of which disorder? Okay, so GABA chills you out. So why would you want to chill out? Because you're not chill, and it means that you have, the answer is anxiety. The answer is B. The answer is B. Okay, generalized anxiety. If you have bipolar, then you need a mood stabilizer. If you have schizophrenia, you need a antipsychotic medication. And personality disorders, there's no pill for that. Okay, you need cognitive behavioral therapy if you have a personality disorder. Which of the following treatments assumes a biological cause for a disorder? So which one of these is a biomedical therapy? The answer is electroconvulsive therapy. All this other stuff, that's talk therapy. Humanistic and behavioral and cognitive. Blank therapy does not use the services of a trained therapist. The answer is self-help. You do it by yourself. Okay, you read a book. I've done that plenty. Okay, that's it. Thank you very much. This will be on a separate